A warm welcome to your Barbados Today Evening News Update for Wednesday, February 10. At least 30 persons today were the first to receive their COVID-19 jabs 24 hours after Barbados received 100,000 doses of the AstraZeneca vaccine from the government of India. They included the coordinators of the vaccine program, Dr. Elizabeth Ferdinand, and Major David Clark, Chief Medical Officer Dr. Kenneth George, and students from the Cayfield campus of the University of the West Indies. Major Clark told this evening's COVID update that frontline workers will get their jabs starting tomorrow.
When we look at the categories, we're trying that people who get ill will not get severely ill, and also we're trying to stop this transmission spread. And so we have been looking at the numbers of people and the different categories. So there are about 5 categories in all. I spoke about the first category, which we are rolling out now, which will be our healthcare professionals, our security people, the governance structure in the country, the frontline workers, supermarket workers, taxi drivers, port health workers. So there are probably 200 different categories of workers that we have gone through. So we have spent lots of time looking at the people that we need to run this country and how we can help them so that this country can function. Because we cannot allow the country to be shut down for a very long time. Certainly we've got to be able to make sure that people can work and also get our society back up and running.
Major Clark also disclosed that the island's 9 polyclinics will be used as vaccination centers. In addition to the polyclinics, there will be static vaccination teams in areas where there are no polyclinics, mobile teams, and drive-through teams. He says some key groups will be able to manage their vaccination process.
So an organization like the QEH will be managing their process. The Barbados Defence Force, which has its own medical facility, will be supported from the Winston Scott Polyclinic to actually vaccinate their people. In terms of the drive-thrus, as the program ramps up, we can have drive-thru stations at the Globe Cinema. You can have the Grantley Adams the Grantley Adams International Airport, the clock tower by the Garrison, and of course, as we get more, we can add. We also have schools and other locations that we have made satellite vaccination centers.
Co-coordinator of the vaccine program, Dr. Elizabeth Ferdinand, says the vaccination process is easy and simple.
Each dose is comprised of half a mil or 0.5 mils, and the nurse will draw that up and will inject, as I said before, into the deltoid muscle of your arm here. And I've just had mine about 2 hours ago. So far, so good. But I'm hoping that we'll be able to have a picture of myself, the CMO, and Major Clark receiving our vaccines today. But you'll have that then, and as Major Clark has already gone through the process, but medically wise, that's what you're going to have, and you will wait until 15 minutes after you've had the vaccine before you're free to go home.
In other news, government's Operation Seek and Save program has so far reached just over 37,000 households. In an update this evening, Senior Medical Officer Dr. Anton Best reported that a number of positive COVID-19 patients have been identified.
We identified just over 200 households, which equated to about 236 persons that were symptomatic, possibly symptomatic of COVID. When we dug deeper, we decided to only conduct tests on those who had symptoms, let's say definitely in keeping with COVID, because the initial evaluation would not have been specific enough. We conducted 105 rapid tests as well as standard tests that have been sent to the lab. Out of the 105 rapid tests, 5 have been positive. And those 5 were diagnosed yesterday. I don't have data for today as yet. When those 5 persons were diagnosed, they were informed, and they've been transported to isolation facility at Black Mangala.
According to latest figures, Barbados recorded 43 new positive cases of the coronavirus on Tuesday from 315 tests. The 43 new cases comprise 23 women and 20 men. 18 of them had already been at the Harrison Point Isolation Facility undergoing assessment. The other 25 persons are Barbadians. The total number of persons diagnosed as positive at Her Majesty's Prison Dodds is 363. Of these, 361 have recovered, and the remaining 2 inmates are included in the active cases. To date, Barbados has recorded 1,857 confirmed cases and 1,504 persons have recovered. There have been 20 deaths from the viral illness.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To regional news in Jamaica, there's mixed reaction from stakeholders, the government's decision to tighten curfew measures to arrest spiraling COVID-19 cases. We get the details from Television Jamaica.
Prime Minister Andrew Holness has announced new curfew orders for all parishes effective 8 o'clock tonight. This is in response to the rapidly rising COVID-19 cases. 403 cases of the virus were confirmed yesterday, the single largest daily tally since March of last year. And with 3 of the country's largest hospitals now at 90% capacity, one medical practitioner says the move taken by the government is a step in the right direction.
We can't keep on doing a steady lockdown completely, but we have to ease, and it's like an ebb and flow. You have to ease and restrict the movement of the people, and as such, the economy will be affected. But that has to be the way forward.
Dr. Alfred Dawes argues that while the number of cases has been quite alarming over the past few days, the number of hospitalization is of greater concern. Dr. Dawes is urging persons to obey the new measures.
The indicators are showing that the hospitalization rates are up. From my experience of my colleagues in the hospitals, they're saying that people are sicker now. So we definitely have to support the Prime Minister's move at this point in time.
The new curfew, which runs from 8 p.m. tonight to 5 a.m. tomorrow, means businesses would have to close 2 hours earlier. But economist Dennis Chung remains adamant that tighter curfew hours will not make much difference. He believes more emphasis should be placed on enforcing the protocols.
At the level of 600,000 people having it, 2 hours is not going to make a lot of difference, right? What we should be doing is looking at enforcement, because we have not been enforcing. There have been a whole lot of illegal parties, and people have just been going about their business.
In the meantime, he's calling for more fines for persons who break the COVID-19 protocols.
On the international front, the World Health Organization has recommended the Oxford AstraZeneca coronavirus vaccine for use worldwide by all adults, including the elderly, in a boost for the jab after a series of setbacks.
In the case of the AstraZeneca vaccine, we had a long review of the evidence, talked to the experts and the people who are directly involved with the trials. We have come out with the following recommendations. Based on the current evidence, SAGE recommends that this vaccine should be administered in 2 doses of 0.5 milliliter each, with an interval of between 4 and 12 weeks between the first and the second dose. And given the evidence that we saw, we realized that extending the evidence between 8 and 12 weeks is the best time really to give a second dose to produce a much better immune response.
That's news, but for the very latest, visit our website at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media and bus terminals, as well as Screenplay at supermarkets and gas stations near you. You can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.